Hello, my name is David Ryan James, and this is extra credit for Dr. Forsman's anatomy class. For this unit, I will be talking about the anterior upper extremity blood supply of what is known commonly as the arm and kind of the semi-shoulder region. So getting into it, first off, some ground rules. The arteries will be labeled, as you can see, in an orange color, and the veins in a blue color. Now, I have labeled the anterior side. There are some posterior sides. They will be noted due to a dotted line as seen here. So getting us kicked off, we'll go with the arteries. So you have the subscapular artery, which goes from the aortic arch, travels along underneath the clavicle, and then branches in, turning into the axillary artery. So as you can see, whenever it comes down, transfers into the axillary, it then has a bifurcation and splits off into the humeral circumflex artery, which goes around and innervates into the deltoid region of that muscle. Furthermore, once it continues down, it splits into two more branches. It bifurcates again into the deep brachial artery and the regular brachial artery, as you can see here. The deep brachial will make a split behind the humerus and then will reemerge on the other side, following along down into the radial artery once it gets past the elbow. The brachial artery will continue down, bifurcating as it goes. It'll split twice, once here and here, into the ulnar collateral artery. Once these travel past the elbow, they turn into more common terms with the bones that they're associated with, which the ulnar artery and the radial artery. There's also an additional one that travels in between into this interosseous space. That is the anterior common interosseous artery. On this side for the veins, because what goes down must come up, we have the subclavian vein up top, which is where everything will end up from the arm. So starting out from the forearm, we have the radial vein and the cephalic vein. A little bit different than the ulnar artery over here. It is not labeled the same. The radial vein travels up and the cephalic vein travels up. Once they cross here, it is the median cuboidal vein. A lot of blood is drawn from this area in particular because a lot of these are very close to the surface and full of blood. Again, we have the basilic vein, which also is a really popular one for donating blood. Usually it gets taken. And the brachial vein, which takes the blood away also from the biceps brachii. We have the cephalic vein, which, as you noticed, was down here as well. It travels all the way up and into the subclavian. And the axillary, which is very common. You might have heard of it before with the axillary artery. A lot of them do repeat with the brachial artery and brachial vein, and the axillary vein and the axillary artery, and then subscapular, subclavian. They are very common, very close together. So now just some additional information for, like I said before, with drawing blood. Usually it is in this area right here. A lot of times they will take this cephalic or the basilic veins. They are readily available. Occasionally, they will take part of the median cuboidal. And in the event that one of these were to rupture, or say that there was trauma to one of these areas, so up in here with the deep brachial, the brachial artery, brachial vein, basilic vein, cephalic vein, all those, if those were to break, then it is a dire situation, as blood loss can be very rapid at this. That is why in arm and hand trauma, usually up in the upper extremity of the arm, usually you would apply pressure up in this area, up in here, near the axillary artery, as to prevent further collateral damage from occurring.